Hi, if you have teeth, then you might need to see a dentist at some point. And if you have epilepsy, there are specific precautions that you should put in mind before doing so. If you have epilepsy and you need an emergency dental procedure, such as you have a broken tooth or dental infection, then you can do that and it is okay, but you don't have lots of time to prepare. What you can do in this situation is that make sure to take your anti-seizure medications on time and be regular on them to decrease the chances of having breakthrough seizures. And we should know that infection, including teeth infection, can be a trigger for seizures. Also, pain and stress can trigger seizures as well, so you and your dentist should know that. And some commonly used antibiotics, such as penicillins and fluoroquinolones, they can worsen seizures, so they better be avoided. And some antibiotics, such as erythromycin, can interact with your anti-seizure medications. If you have an elective dental procedure, then we can plan ahead of time. And these are the things that you can do to plan. The first thing is that be regular on medications and take the medications as prescribed by your doctor and not miss any dose. And be regular on your sleep and have enough 8-hour night sleep so that you have a calm brain and not have breakthrough seizures. And the last thing is to have avoidance of any known triggers for your seizure. And the second thing is to discuss with your own neurologist to make sure that there is nothing else yet you need to do or prepare. And the third thing, there is no specific time from the last seizures that you had, but every case is individualized and will be to your neurologist's discretion. And it is important to attend the visit with some other family or a friend that can drive you in case of an emergency happening. What should we do during the visit to the dentist? Well, during the visit, first you should tell your dentist, and they will ask as well, if you have epilepsy and seizures and what is your seizure control, what time was the last seizure, when it happened, and if you have any rescue treatment, those medications that can be given in case of an emergency for seizure. They can be nasal medications, buccal medications in the mouth, or even rectal. And your dentist should do the procedure in a short time and should be fast to avoid the small chances of seizures happening during the procedure. What should we do if a seizure happens during the procedure? Well, first of all, we should abort the dental procedure, which is obvious, and take out any instruments or sharp things that can injure the patient while having the seizure. We should keep the patient on the bed or on the chair for the dentist, and we should lower it as much as possible so that we can avoid injury. And we should avoid putting anything in the mouth because that can also cause dental or teeth injury because of the sharp instruments or anything in the mouth. And we should never restrain the patient or hold them. They will stop seizing on their own in about 95% of the time. So most of the seizures will stop on their own in between 1 to 2 minutes. However, in about 5% of the time, seizures can stay longer and reach 5 minutes and continue longer than that, which is called status epilepticus. And at that time, if the seizure lasts for 5 minutes or longer, we should administer those rescue treatment by nasal, buccal, or rectal medications if we have them. And we can give them intramuscular midazolam or intravenous lorazepam or diazepam, so any benzodiazepine that is available, and we should call emergency services right away, like 911. And sometimes after the seizure ends, the patient will be confused, agitated, or try to move out, especially in an unfamiliar environment, so we should be prepared for that and have some family member to calm them down if this happens. Let me know down in the comment, are you worried or ever had a seizure during your dental procedures? All right, let's talk about some anti-seizure medications and their effect on the teeth. Well, some anti-seizure medications like valproic acid or Depakote, they can cause decrease in the platelet strength and can cause bleeding disorders or tendency towards more bleeding, and your dentist should be aware of that and do precautions in packing good and having more blood control procedures. Some anti-seizure medications such as phenytoin or Dilantin, it can cause overgrowth of the gum or called gingival hyperplasia, and that can be very disfiguring and very looking bad, and it might need some dental procedures to shave that extra gum or change the medication as well. Many anti-seizure medications, especially carbamazepine and tegretol, they can cause xerostomia, which is dryness in the mouth and decreased salivation. And saliva is a natural cleanser in the mouth, and decreased salivation can lead to decay of the teeth. And very important to realize that anti-seizure medications, the liquid form of it and Depakote sprinkles, they have loads of sugar. They're kind of like syrup. And this high concentration of sugar can lead to teeth decay in children especially. Very importantly, if they take their anti-seizure medications and go directly to sleep, the sugar will be filling the mouth, there will be bacterial overgrowth, and that can cause to lots of teeth decay. So what we recommend is that after taking the anti-seizure medication at night, have the child go to the bathroom, brush their teeth and swish it very good so that will be a healthy mouth and not having tooth decay over time. Can I get numbing if I have epilepsy? Well, yes, you can get local anesthesia using lidocaine, and most of the time it is safe in epilepsy. However, there are some case reports of people having worsening of seizures or having seizures de novo without any previous epilepsy after using lidocaine, and most of the cases where the lidocaine is injected directly into the artery or the vein, going directly to the blood with high concentration, and that can induce seizures. So what your dentist will do will be very careful. When they inject, they will aspirate, means like pull up the needle, make sure that the needle is not in a blood vessel, artery or vein before injecting, and usually that will be sufficient to not cause seizures to happen. And in some cases, usually with developmental delay, autism, cerebral palsy, they have high prevalence of epilepsy, they might not be able to sit still for a dental procedure, and they might need general anesthesia. And general anesthesia is okay as long as it was planned by the neurologist and the anesthesia doctor. In some cases, we can do some conscious sedation using nitrous oxide, which will relax them, and it is safe in epilepsy as well. So there are multiple medications for epilepsy and seizures, and to learn all about the anti-seizure medications and how they work and what are the potential side effects and which treatment is best for which epilepsy, you can see this video in details, an easy way to understand all the anti-seizure medications. And stay healthy, and see you in the next one. Salam.